your spouse ever snore loudly, or maybe you think that you are not getting a good night's sleep, but you still feel kind of sleepy during the day?
I do.
To you.
Yeah, I actually have this too. You may have sleep apnea, and once proper diagnosis is made, there are solutions. The CPAP machine is a popular option, but I would highly not recommend it. And for many, it's really uncomfortable. Dr. Matthew Nawrocki is here with Jacksonville Dental Specialist, and he's going to talk. It's part of our new weekly Dental Health Watch segment, and today they've got another option that is much less cumbersome. Yes. Thank you so much for being here. I personally have a mild case of sleep apnea. I went and did the test, the sleep test, and the whole thing, and I had no idea, but I was tired all the time during the day. Talk about what obstructive sleep apnea is first, and then we can get into.
Obstructive sleep apnea is basically a pause in breathing when you're sleeping, several seconds to a few minutes even, as hard as that is to believe. But it's often accompanied by snoring. That's a common sign or symptom. With a lot of people, they get an obstruction of airflow, and this is what results in the snoring. So snoring is kind of a common sign or symptom, but you're actually getting a pause in breathing. And so this has a lot of health implications. Lots of people like yourself don't even know they have this going on. And so they're constantly tired throughout the day, but it affects a lot of people.
You were just saying constantly being tired throughout the day is one sign that you might have sleep apnea, but how do you know? If someone's watching right now, how do they know if they're suffering from this?
To get diagnosed, a sleep study, whether it's in a sleep laboratory or they have home sleep kits, can be used. And then ultimately, a diagnosis by your medical doctor has to be made.
But how do you get to that point to think that you need a sleep study? Is it just the fatigue, or is it you're snoring, you're waking up in the middle of the night? What is it?
I can tell you my symptoms. I mean,
literally,
I could, because firsthand, because I have it, So I would wake up in the middle of the night sometimes, and I would gasp for air. Other times I'd wake up and I'm kind of like, oh my God, and my heart would be beating really fast, and I'm like, what is going on? And then I would be sleepy.
Wow.
We'd finish the show, I'd go home, I'd have a lunch or something, and I had to take a nap, and I'm like, this is not like me, So we luckily had somebody on that talked about sleep apnea.
So if you're tired, you have a dry mouth when you wake up, headaches, fatigue, these are all possible signs or symptoms. Lots of people, though, don't have any of these. So you may not know, but if you have any of these signs or symptoms, it's worth checking out. It's about as common as type 2 diabetes. There's about 18 million
And if you
people.
have a spouse, I would assume too, and they say, my husband or
You're
wife
snoring,
snores a lot,
and
it's really loud, maybe you should just go get checked out.
If you wake yourself up when you're sleeping because you're snoring so loud, and basically what happens is the base of the tongue and the throat kind of collapse. That's what results in you choke, you try to gasp for air, you start snoring. And so a CPAP machine, if you ever see someone with a face mask, that's kind of the industry standard, but most people find that intolerable. It's embarrassing. If you're dating, I've had a lot of people say, I can't wear this. My partner here, it's embarrassing. So as dentists, we have kind of a unique perspective on how we can help people with an intraoral appliance. We make these day in and day out, and it's a very easy thing that your dentist can do for you, or we here at Jacksonville Dental Specialist can do it. But for mild to moderate sleep apnea, this is a wonderful thing, as you can attest to it. For someone who's severely sleep apnea, have a lot of obstruction going on, the CPAP machine is really the gold standard. But mild to moderate sleep apnea, which most people kind of fall into that, this is very good for them. So it's something your dentist can help you out with.
And I think we should get more into the actual thing that you were talking about, the oral appliance that you guys can do. But what are some of the effects of somebody that has sleep apnea and they have this for long term without diagnosing it, without fixing it?
If left untreated, heart disease, hypertension, diabetes, irritability, all these things have been starting to be attributed to, at least in part, to sleep apnea or an interruption in breathing during the night. So it has a lot of medical implications, certainly if left untreated. So it's really coming to light. Yeah.
Very serious. So you guys can help as far as making it an appliance. How does it work? What are you doing?
You're basically unobstructing the back of the throat. Where the base of the tongue and the throat meet, it causes a blockage of air. Not always, but oftentimes with a sleep apnea person. So this advances the jaw a little bit forward, kind of protrudes it just a little bit. It's comfortable, and basically unblocks the back of the throat,
so
the
the
airway.
Tongue doesn't fall back.
Exactly, preventing the tongue from falling back. There's other ways. Weight loss, changing the position, how you sleep can all affect it. But risk factors are being a man, overweight, over 40. It affects African Americans and Hispanics much more frequently. But women and even children can be affected by this. But mostly men. If you work out a lot, if you're a football player, wrestler, if you have a big thick neck over 17 inches, you're at a higher risk. So Overweight men in their 40s, you know, typically are a little bit higher risk, but even you could have it. You might snore and your husband doesn't tell you.
Yeah, bless his heart.
Sweet guy he is.
Smack. No, but it is serious. At least check out.
Yeah.
At least come in and see.
Yeah, ask us, or you can ask your dentist. You know, they should be able to at least point you in the right direction, or you can contact us.
So that's what I was going to ask. So if somebody comes in and they say they're having these symptoms, they talk to you. They can talk to you about it, and you can kind of, at least from the symptoms and everything that they're telling you, diagnose it, and then you would get them a sleep study.
Exactly.
And then you could fix them with the oral
If
appliance.
we're treating snoring, you don't need a medical diagnosis. But if we're truly treating someone with obstructive sleep apnea, first you need a sleep test. Your medical doctor needs to make the diagnosis and then prescribe the appliance, which your dentist or myself or one, you know, your regular general dentist can make. But to have a medical diagnosis is necessary to treat obstructive sleep apnea.
And that will also help with insurance, because then insurance
Exactly.
will
If you're
cover
going to bill medical insurance, which this is one of the few dental things that we can, you do need a medical diagnosis to make that doable.
Great.
All right, Dr. Nawrocki, thanks so much for being
Thank
here.
you.
We appreciate it, and thanks to Jacksonville Dental Specialists for sponsoring this segment.
Call 904-460-4201 today to schedule a consultation, or visit their website to learn more at NawrockiDMD.com, or call Richard Aguila, actually RichardAguilaDDS.com as well.
Yep, and all of it's right there on your screen.